because the isometrics I don't think work in the shoulder as well as they do in some of the other areas. So I'm not totally sold that it's a true tendinopathy.
Yes.
And maybe it is, and maybe it just doesn't work. I don't know. But some of the strengthening was more important for getting that right, because I think actually they're getting, gliding, issues. And maybe that's compressive, and then doing the strength works, getting them back into the right position. I'm not sure, but the isometrics just, I don't think, work as well as what we think they might in other areas.
Yeah, cool.
But then in AFL, it's a lot more traumatic shoulders.
Yes.
Your anterior instability, AC joint injuries, clavicle fractures. I think the shoulder issues are more traumatic. Whereas volleyball was much more use-based. Like they would serve in a training session, they could serve 80 times. Serve or spike, sorry. They're doing overhead action. Potentially 80 to 120 times in a 2-hour training session. And the other hard part was because they get patellar tendinopathies, they'll often go onto a box and serve rather than jump. So not to jump.
Chain.
You lose the kinetic chain, which I found then would overload the shoulder more. So they would try not to jump in one of their sessions of the day, because they would train twice a day. So they might not jump in the morning. So they might do serving or spiking, but from a box. And obviously, I think that just you lose that kinetic chain.
Yeah, what a conundrum. You
so it's
try to help one thing and just blow out something else.
So it's really interesting.
Yeah, that's really interesting insight, and that's we'll probably just keep diving down that rabbit hole there for a second about the isometric work, and Sarah, you sort of got some interest here. Like, what's that disconnect from what we're probably seeing in the lower limb benefits, and even that's probably being a bit argued at the moment, depending on which research paper you see, but that early work from Ebony Rio and Jill and other colleagues about, the pain relieving benefits of isometrics in the lower limb. What are you guys seeing? And, it could be a gut feel, it could be absolute, hard evidence. What role do you see isometrics playing, I guess, in the early stages of a presentation to any of your athletes that you see, or a general population and whatnot?
Well, I agree with Darren. It's a little bit of a rabbit warren at the moment. And there's, I know we're not talking too much about research, but if anyone sees this and gets to read a great overall paper by Villa de Hughes on summarising shoulder tendinopathy, I highly recommend it. And basically, we don't know the answer yet about isometrics, and I think Ebony and Jill Cook would agree with this as well, that the tendons in the shoulder are different to the knee and the ankle, and to the Achilles rather. The shoulder is multi-plane. It doesn't go as cross limited planes like the knee and the Achilles. It blends with 4 other tendons. It's got a rotatory unstable joint underneath. The scapula is its base, which if that's not in a good position, then you're in a bad spot to begin with. And it blends with the synovium, which is really highly vascularized. So I think if you have a patient that's had just an acute overload and then you rest them in 24 hours, 48 hours, they should be back to normal. If they've got a reactive tenopathology that's ongoing, I would definitely say there's an underlying biomechanical breakdown in the chain, just like you said. And so if you're loading that isometrically without fixing their biomechanics and letting the reactivity settle, I just think you're loading on a poor base, and that's one of the reasons it may not work. So another reason is, pain. I don't like pain with exercise. Fatigue is fine, but I'm a no pain person with isometric loading, and for me it doesn't work in the shoulder. And this is just what I see clinically, because it just reacts the tendon for me. And so if they've got an unstable base and then they're loading, they're getting pain. I just know usually that either the tendon is already overloaded and I'm contributing to excessive load, or their scapula isn't in the right spot while they're loading, and hence if the glenoid isn't orientated properly, the humeral head doesn't sit in the middle, and the shoulder is not happy unless the glenoid is centered. So then you get compression of the cuff. And we know firing at the motor unit changes when there's pain. And the shoulder's really, I don't know if you guys find this, but motor control is obviously more of an issue around the shoulder. So it can do weird and wonderful things in terms of motor control versus the lower limb. And so if there's pain, I know that's going to affect someone's motor patterning. So I don't like to have pain when I give my dosages. I will use isometrics when I've got my scapula in the right position and I'm maybe seeing if the cuff is going to be ready next week to tolerate some through range load. So it's almost like a bit of a retest for me. And also I might use it if, say, I think my scapula is good enough, I'm going to start some external rotation. Okay, can you load that for me in external rotation? Good, you can hold your scapular position. That doesn't hurt. Right, let's try the exercise. It's almost like a test to see, are we going to be able to control this movement?
Yeah.
That's what I do.
Yeah. No, so just to reiterate, like if you've got, like the scapula effectively is going to be this front and center of what you're trying to do there, right? So you're not particularly, you can do all the isometrics in the world. You can get into a doorway and push into, the doorway externally. You can pull across internally. Like if this scapula is just not in the right spot and you're diving in and touching into a little bit of pain, is that just like a pointless thing to do? Like
for me, it's pointless. So I had a tennis player the other day. He's had shoulder pain for 5 years, and he's had multiple bouts of physio. He's no structural lesion, and he hasn't gotten any better. And so, and he's like, I'm pulling on my bands, doing all my isometrics. I'm like, okay, and he's like, it just grumbles away at this 3 out of 10, and I just feel like I don't have this power, and it's just always a little bit sore, but I can still play. I'm like, okay, show me what you're doing. And the scapula is downwardly rotating. It's anteriorly tilting, which offsets the glenoid. You put him in the right position and get him to redo those movements, much less pain. So that's creating for me that tendon overload. So I'm a no pain with isometrics. I think they're fine to use, but I'm just not in the. I don't do it with patients like Darren mentioned.
What about you guys?
I was just gonna.
There's no right or wrong. Let's not.
we're
not trying to.
That's just what I do.
Throw you under the bus or anything like that.
Yeah. Look, in a situation where I probably do use it is in the tournament space, because they'll come in and with their shoulder pain, let's just say, and you sort of have a look at everything you're saying and maybe correct their scapula and get them to show you what they're doing for their warm-up, let's just say, for example, to prepare them for when they're going on court, and they're doing, 60 IREAs in all sorts of different positions, and obviously then going out on court and then doing it again another 200 plus times. So I would ask them to, stop doing that in their warm-up and get them to maybe just do a few isometrics to warm them up before they go on court in the right position, as you're saying, like making sure their scapula's okay, the humeral head position's all okay. But that's probably how I would use ISO, so they're still getting that preparation before they go out on court.
Yeah, it's a nice idea.
And I think I was going to say too, like it's not that I don't use isometrics, I just don't use them as a pain reliever, like for a tendon.
Yes.
Like if I, in the general pop, if I've got someone with a really significantly degenerative tendons that's seen on MRI and they might be grumbly with external internal rotation, I might get them to do an ISO, but more as an activation, can they hold it? Because you'll see, even the athletes, you'll see, you get them to push against your arm and they'll drop and they just don't have any control.
Totally.
So I will use it, but it's not as a pain relieving exercise like I would give it for a knee or an Achilles.